Hello everyone, my name is Dr. Ahmed Hanfy Mahmoud. I'm consultant clinical psychologist at Moodie Health Abu Dhabi. I'm a trainer, supervisor, and advanced schema therapist from International Society of Schema Therapy and founder of Schema Therapy Egypt and regional coordinator for Arab countries and North Africa. I'm very pleased to be and participated on this initiative about World Schema Therapy Day, and I'm very happy to participate in this initiative to publish the concept of schema therapy in the whole world. Today, we will discuss together the schema therapy for substance use through case example to a developmental model. I'll start my presentation by case study of one of my patients. His name is Islam. Islam is a male, 27 years old, born in Egypt, lives in Saudi Arabia and back to Egypt 3 years ago. He is single, has one brother. He lived with his father and brother since his mother left the house 15 years ago. Bachelor of degree of business, non-employment. Why he is in therapy? He came involuntary. He came by force. His father is bringing him to the therapy because he is refusing to be treated. His problem was drug addiction. He is addictive on heroin, tramadol, Lyrica, and marijuana, with another behavioral addictions like sex addictions, stealing his father's money, scam issues, destruction behaviors, manipulative, and liar. When we try to understand the level of function in his major life areas, we found he get like 0 out of 5 in most of our criteria. Like occupational and school performance, he get 0. He succeeded in his college by cheating and pride. He isn't work, no commitment in everything, anything. About his intimate and romantic relationship, he got also 0 because he does not care about feelings or establish any kind of relationship. He meets many girls, but for casual sex or to abusing them financially. He loved once, but she left him when she knew about his addiction behaviors. About his family relationship, he got 1. He doesn't spend time with his family at all. He hits his father a lot and brother. He didn't look for his mother and no communication with her since she left the home during his childhood. About friendship, relationship, he got 2. He has many friends, but most of them, they addictive, hackers, and programmers. The relation based on business and entertainment. About celerity and functioning time, he got 0 because he spent most of his time in drug abuse, watching porn movie, reprogramming credit card to use it and scam issues. When we try to understand his roots, Islam grew up with his parents and a brother in Egypt. The parent of Islam divorced when he was 12 years because the father catch his wife cheating on him. Then he moved with his father and brother to Saudi Arabia. His father was an officer in the military. He always absent 2 weeks per month, and the other 2 weeks he is at home. But his father has a lot of problems because he is too stingy, didn't pay for anything except the food and education. He is very critical and punitive and violent with them. He smashed all of his family members by using his hands, stakes, any tool into the house, like TV, fridge, knife, belt, etc. Also, he had many sexual relationships and many affairs. About his mother, she was also unavailable. She worked as a teacher, spent 8 hours at school, and held private lessons after to combat her financial insecurity. She had an emotional relationship with other men until the husband knew. Then he smashed her and divorced her after the father knew about her cheating. His big brother always wanted to avoid his father's violence, so he told him everything happens at the home. So was a cause for Islam's suffering when he told the father about Islam actions. Islam also had several traumas during his childhood and adolescent stage. His father violent with him and his mother cheating, and the bullying from other family members about his mom and about how she is not a good person, and also rapping situation many times under threat in Saudi Arabia, because when he's moved with his family to Saudi Arabia, he started already on the marijuana, and it's too difficult to get his marijuana in Saudi Arabia So he has to go to the desert. When he went to the desert with his colleague, which is Sweden Arabian people, some of them they abusing him sexually, and they taking like a video shots for him and threatened him if he didn't come and obeying them to do it again, they will publish or posting this video in everywhere, and they will send this video to his father and to his family, which is very ashamed. And based on the relationship with his father and with his family, he can't like take any risk on that issue, so he has to obey them. But don't forget, he was around 13 or 14 years, and he's raped many times. And they threatened him if he refused this kind of rapping, they can kill him in the desert and no one will know him. So this is like a small background about Islam. So why schema therapy for addiction? Why schema therapy for substance use? Schema therapy, as we know, designed for complex cases. As we know, many of intervention was designed for addictive disorders. But till now, the percentage of the recovery, not more than 60% in the best scenario. And second point is often we found a relationship between the addiction and the personality disorder, which is the schema therapy designed for. Most challenge in the recovery process related to therapeutic relationship based on the mistrust abuse on sometimes rejection, any kind of control or authority figure. And last point, the beginning of addictive disorder related always to the types of attachment style at home, which is considered the core of schema therapy. So if we're looking for the unmet needs of addictive parents or addictive patients, we will find like attachment and belonging, validation and acceptance, safety and security, guidance, efficiency and competence. All of this need, they are unmet during the addiction process. When we're looking for the early maladaptive schemas of addiction, we will find mistrust and abuse, emotional deprivation, defectiveness, insufficient self-control, emotional inhibition, abandonment and instability, social exclusion, entitlement, subjugation, schema. All of the schemas is like common schemas with the addictive person. And when we are trying to understand or looking for this schema based on the attachment style, based on like Islam as a case scenario, we will find a lot of evidence which support all of these schemes. Like mistrust and abuse, his father has a lot of like affairs out of marriage. His mom has like also affairs and cheating on her husband, and she left the house. Also, the family members, they are like humiliating him, abusing him verbally and physically based on his mom stuff. And they weren't a support system at all. About emotional deprivation, we will find a lot of memories, a lot of origins. He doesn't or he didn't get any kind of love or care or interesting or admiration or at least guidance. Defectiveness and shame, if we're looking for the Islam lifespan, we will find him through his childhood till the end of adolescent stage. He's just ashamed. Ashamed because his father is stingy, because his father is violent, because his mom's actions, because his father's actions, for rapping, for his brother who's telling the dad about everything is Islam doing it. So everything is related that I'm unworthy person. Insufficient self-control when he's going to try the addictions behaviors, when he's going to try marijuana, alcohol, cannabis, heroin, tramadol, he can't control himself. And his father, he can't control. So a lot of schemas, a lot of origins, a lot of memories related to I can't control myself. So did he get the chance to express about emotion? Did he get a chance to understand his emotion? Did he get a chance to know about this track of emotions and thoughts? Never, which is expressed about the emotion inhibition. It's not allowed to him to speak about anything related to these emotions or thoughts. Social exclusion, he has to hide because the mother action is like walking behind him. Everyone is knowing him or knowing his dad or knowing this kind of family, they will like abusing him. So he has to exclude it. And inside the house, there are a lot of spy, like his brother is spying on him to avoid his father action. So he's shy, the mother is away, the father is in his bubble, and he's not care about them. So most of these schemas is like atypical for the addictive behaviors. When we are looking for addictions coping mode, we will find the first one, which is like known for each one of us. It's about self-soothing. Self-soothing, it's related to using a lot of addictive behaviors, addictive actions with non-stop. Conning and manipulation, detached protecting coping mood, pulling and attack sometimes, and self-aggrandizer coping mood, with a harsh punitive inner parent mood. So if we are looking for the schema model for addiction, we will find like a punitive critical parent always inside him, with angry child like impulsive and undisciplined child, with vulnerable child, abandonment, abuse, humiliated, lonely, sadness child, which try to handle all of this pain using some coping mode like self-soothing and manipulation, detached protector, and grandiosity. And the space of healthy adults, it's very capped, it's very limited, like you see now on the screen. So if we are looking for Islam formulation in a schema model, we will find a lot of unmet needs like safety and security, validation of emotion, guidance and care, lack of freedom, independence and incompetence. When you're looking for his schema, we will find effectiveness, mistrust, abuse, entitlement, and emotional deprivation, social exclusion, emotional inhibition. For his moods, we will find abandoned, lonely, abused, angry, enraged, impulsive, and undisciplined child. About his parent, he has a very severe punitive critical parent. About his coping mood, he has rebel, predator, manipulative, and bullying and attack coping mood, with the most important thing about detached protector, spacing out, and self-soothing coping mood. About his healthy adult potentials, we found him he is a smart because he's a perfect, or he's doing very well on the scam issues. He's using his every single cell in his mind to scam, to find a way to survive, to hide. So he's a smart. He has a lot of or high social skills, some responsibility towards his friends, towards his like scam programming time to learn to develop his skills, leadership skills, and he is funny, which makes him like lovable for all of his colleagues. So now I try to understand or try to connect between the dots. So as a model development for addiction, I have like you see now like three criteria. The first category is speaking about some like vulnerable risk or risk factors. So we have like three items on the left of the screen, explains or shows my vulnerability as a patient since my childhood to be like a vulnerable for the addiction. Like trait of impulsivity or risk taker, we know it's common sense with all of the adolescents, but some people or some of our adolescents people, they have this trait, it's a little bit higher than others, which makes some of them like willing to play like dangerous games, risky games. So taking a lot of like impulsive action, escaping from the school, doing some stuff. So they have a little bit like high impulsive trait. Second item is about, and this is what Bozers spoke about it in his model, about the motivation to be an addictive. Motivation to be like try, motivation to engage in any risky behaviors, motivation to try something new, something unusual, something is like dangerous, something on like black side on my in our life. So Bozers mentioned one of the main issues to be an addictive, the trait of the motivation to be an addictive. And the last point of the vulnerable risks is about like other mental disorder, another psychological issues like ADHD, conduct disorder, learning disabilities, which like pushing our patient or our vulnerable patient to looking for someone or raising the vulnerable things to try something as a self-medications. So all of these 3 points, it's like risk factors, which makes our patient too much vulnerable to be an addictive. On the right side, we can found another issues, which is like participate to raise the percentage to be an addictive. Like if we have like addictive parent, like alcohol father or alcohol mom, or we have like pornography parent, or I saw my dad has a lot of affairs, or he is gambling, or he is doing any kind of addictive stuff. So addictive parent increasing the percentage to be an addictive. The second point, and actually this is a very common point at my countries or in Arab countries about culture concepts. How to be like a real man. Like in my country, in my culture, the man not give up. The man has to move on. The man has to try everything. The man not crying. The man not explore his feelings. So the man has to deal with his pain in a silent way. So if someone is like inviting me to have some like smoking or vaping or doing some dangerous stuff, and I said, no, I can't do that, my dad or my mom, so I will be like a joke between my friends because our culture speaking about the masculinity traits has to be like active, has to be like danger, has to be like risky taker. So my culture or our culture sometimes is like activating our impulsivity, activating our motivation to be an addictive, activating the risk factors. So the culture concept has to be like under our awareness as a main concept for increasing the vulnerable risk to be an addictive. And the third point related to this criteria, it's about availability and accessibility to the drugs. So some countries, it's very easy access to get any kind of addictive behaviors, but other country, they have like limit. Like I'm now living in UAE, so if you are staying in Abu Dhabi, you will find all of the pornography or porn sites is blocked. But if you moved to like Dubai or my home country in Egypt, it's open. So the accessibility is different. In my home country, you can easily find marijuana, you can easily find heroin, you can easily find crystal meth, you can easily find another drugs, but and sometimes it's hard to find. In some countries or other countries, it's hard to find. So the availability of the drug or the stimuli, it's increasing also the level to be an addictive. So this is like a factors, internal and external factors, who's increased the percentage to be like an addictive. So in the bottom here, we have very important thing, which is related or giving or sending us again to discuss the schema therapy for addiction. We have the parenting relationship, the attachment style. The attachment style for me, it's like a protective wall. It's like the most important part as a prevention way. If you have like a secure attachment style, it's protecting your child. It's protecting like Islam, our patient. He have if he has like a secure attachment, because when he is inviting to try something and he has an attachment or secure attachment, he can come back to discuss it with his father or with his mom. And as a father or as a mother, if I'm doing something wrong, based on the secure attachment style, I can excuse to my child. I can explain to him my weakness point. I can discuss with him how I'm sick. So I will not transfer my disorder to him. So the attachment style, it's like a key point here to prevent my patient, to prevent my child to be an addiction. And the second part, it's about skills training. Don't forget that usually it's starting always addiction behavior is starting to try as a risk factors, like we said, impulsivity, risk taker, just to adapt to the culture concept, to motivate because I'm motivated to try. But after a while, the addiction or the self-soothing behavior, it comes as a first card to use to deal with any kind of emotions, anger, sadness. pain, grief, vulnerability, weakness, disadjustment or disadaptive with others, adjustment with others, not functioning well. So it's used always as like a first card to deal with all of this challenge because he has no skills. If we are looking for Islam lifespan, you can tell me one thing he learned as a skill, except how to hide, how to avoid, how to like doing things in behind the scene to protect himself from harm, from aggression, from violence. This is the only skill he learned or he taught. So the second factor, it's about skills training. And if we moved to the third part of this equalization, we will find the support system. If my parents has like a lack of attachment or secure attachment, where is my family members? Where is my teachers? Where is my coach at the club? Where is my friends? Where is my family friends? If we're looking for Islam, we will find all of the social relationship, all of the social network, it's like abusing him, like labeling him. So there is no attachment style, no skills training, no support system. So it means I don't have any other option to be an addictive because this is the easiest way to deal with. So if we are looking for how is the relationship between the schema therapy and the addiction, so I have to focus or to start with the attachment style or parenting skills. And actually, this is the first thing I have like suffering a lot with Islam to deal with. It's about limited reparenting. He didn't give me easy access to parenting him based on his experience with attachment style, based on his relationship with his father, based on his punitive or inner punitive parent, based on his schemas about mistrust abuse, about emotional deprivation, about defectiveness, about emotion inhibition. So a lot of origins, a lot of memories which prevent me to deal with him or using the limited reparenting with him. But after a while, after a few months, after a lot of situation, and he is trying hardly to listen to me, I tried hardly to connect with him, and he catch my honesty and my keen to be with him on his journey. He opened gradually the door for me, which is like a big improvement happens. So the limited reparenting here, it was like the key figure, the key point to resolve his attachment style. So this is the first part. The second part for me, it's about unmet needs. Every one of us thinking about unmet needs, about love, about belonging, about attachment, about a lot of stuff. Yes, it's true. This is first priority of unmet needs. But actually, with Islam, I found two big unmet needs, which is taking my first priority with him. The first one is belonging. You belong to me, I belong to you. We are teammates, and it's with integrity. But the second one, which is surprising for me, actually, it's about advising. It's about guidance and care. Guidance and care, it's not about instructions. It's about Islam child birth, which doesn't know anything except hiding, planning, abuse. He doesn't know anything except these three words. So when he wants to hide, he has to use his self-soothing behavior. When he is in pain, he has to use his self-soothing behavior. He doesn't know any other things. When he's angry or like stimuli, or irritated. He's thinking how to hide, to plan, to abuse this one, which needs self-soothing behaviors to can plan. So the guidance here, it was like the key need to ask him to develop his skills. Then we moved to support system by integrating him in a group therapy using the same module of schema therapy to know how to receive love, how to receive the care. The journey with Islam, actually, it wasn't easy at all. It takes more than 2 years with him to work, of hard work. And I'm not speaking here today about Islam, but I'm speaking here today to try to formulate like a big model, or like to conceptualize not a new model, but it's like a big model can understand or can take in his components all of the theories which discussed the internal triggers and the out or external triggers with our schema understanding for the schema therapy. So this is my like first initiative to try to understand or to correlate between all of these items. Inshallah, hopefully, by the International Society of Schema Therapy in Greece in next June or next May in Greece, I will participate with like a few studies with a lot of case presentations, which like formulate my last work of the developmental model to encourage the other people to work with me or to cooperate together to develop this model, to have like a great model for schema therapy for addiction or for substance misuse. Because, for me, the addiction, it's not like just disorder like depression. For me, the addiction is something is huge, something is need a lot of like effort, a lot of work to understand, to work on it, because it's not changing the patient life. Actually, it's changing the whole family and the whole society's life. And to be honest with you, for me, I spent like almost 15 years working with addictive persons in different areas, in different country and different cultures. For me, who's making me as a good therapist with all of the disorder, it's working with addiction. To be close with addiction people, it's very, very informative. You will see another layers or depth in the human being, which encourage us to learn or to taught more about or to teach more about the addiction behavior and concepts. So I encourage every one of you to read a lot, to work a lot about addiction and schema therapy, or to communicate with me if you need to start to do something together about this initiative, because actually I believe on that. So thank you so much for listening to me, and I hope to see you soon in Greece 2026. See you.